Good evening. This is All India Radio, Kohima. I'm Jonas Yandan with Evening News. The headlines. Single highest spike of COVID-19 reported in the state with 26 new cases, increasing the total tally to 156. Nagaland government approves creation of 53 posts of specialist doctors in all 11 district hospitals. Nagaland government spends over 8 crore rupees for management of quarantine centres in all districts. And total lockdown imposed in Mon Town beginning today till 15th June. Another 9 more persons have been detected with COVID-19 positive today, in addition to the 17 new cases reported, making a total of 26 new cases in the state today. This is the single highest spike in the number of positive cases in the state since 25th May, when the state reported the first cases of positive cases. With this, the total confirmed number of COVID-19 positive cases has increased to 156, while the active cases stands at 107 and 49 patients have recovered. All the 107 are of asymptomatic cases and are receiving medical treatment at the designated COVID-19 hospitals. Meanwhile, 36 patients have recovered from Dimapur District Hospital, 6 from Chetima, 2 from Naga Hospital Authority, Kohima, and 5 from Twensang. Health Minister S. Pangyapom, in a tweet updated this morning, said that another 9 cases of COVID-19 positive have been reported out of 251 samples tested at Naga Hospital Authority, Kohima. He said 6 patients are from Dimapur Quarantine Centre, 2 from Kohima, and 1 from Berin Quarantine Centre. Earlier, the Health Minister also tweeted that 17 new cases of COVID-19 have been reported out of 67 samples tested at Dibrugarh. The central government today said that the recovery rate from coronavirus has reached 49.47% in the country, and the total number of recovered people is 1,47,195. The total active COVID-19 cases in the country stands at 1,41,842. Nagaland government has approved the creation of 53 posts of specialist doctors for 11 district hospitals. This was informed by the state spokesperson of COVID-19 and Minister Nipa Grono during a press briefing held at Kohima today. He said a state cabinet in its meeting yesterday decided to create 1 post for Director of Medical, Education and Radiation Safety at a level of special selection grade, creation of 5 posts of Zonal Leprosy Officers at Longleng, Kifre, Beren, Pek and Zonoputo at a level of senior grade, and government of 2 posts of District Vector-Borne Officer at Twensang and Zonoputo in the cadre of the Nagaland Health Service, as and when the present incumbent vacates the same, to be manned by medical doctors, and 143 posts of staff nurse to be deployed in all district hospitals. Grono informed that the cabinet had also approved age condonation of 28 staff nurses under Health and Family Welfare Department, and fresh appointment be made against the sanctioned post, regularization of 19 serving contract medical officers under the Health and Family Welfare Department, and regularization of 27 existing medical officers who have been engaged by the department for a period of 1 year. The minister also informed that, as directed by the cabinet, this approval is of one-time relaxation of laid-down rules and procedures for recruitment, regularization, and condonation of age. Grono said this one-time measure taken by the cabinet is in view of the prevailing situation of COVID-19 pandemic, which will not be treated as a precedence. State spokesperson for COVID-19 and advisor Mohanlamo Kikon said a total of 8,68,63,146 rupees have been incurred by the Nagaland government in preparation and management of quarantine centres in all the districts till date. Addressing media persons today at Kohima, he said the state government, through the district task force, hires caterers for all the mess services in the quarantine centres. Kikon added that if there is any complaint on the quality of food, the district task force should ensure that the caterers do their duties for the amount being paid by the government. He further said an amount of approximately 1.65 crore rupees have been spent on transportation to bring back the stranded citizens. Kikon said 32 buses have been hired to transport the citizens from 13 different states along with 9 special trains. This news comes to you from All India Radio, Kohima. The Deputy Commissioner Mon Thawasilan K has informed that a total lockdown is being imposed in Mon town beginning today till 15th of this month. This is in view of the impending arrival of the returnees from Dimapur and proposed testing of the returnees in the quarantine centres. In regard to this, the DC has notified that movement of public and private vehicles is strictly prohibited except on medical emergencies. All shops will remain closed except pharmacies, offices of DC, SP, banks, fire and emergency services, health and family welfare, power, PHE, treasuries and accounts, PWD, roads and bridges, Bara military forces are exempted from the purview of this order, and movement of essential commodities and goods vehicles is permitted. The total lockdown is enforced with a view to facilitate transportation of people to various quarantine centres in Mon district and collection of throat nasal swab for COVID-19 testing. The DC also informed that any person found violating this order will be penalised under relevant provision of the law. A special Shramik train from Thiruvananthapuram, Kerala, which departed on 9th June carrying 966 persons, will be reaching Dimapur tomorrow at 5:30 a.m. The train has been carrying stranded citizens of Nagaland from the state of Kerala, Tamil Nadu, Telangana and Andhra Pradesh. In view of the arrival of the special train, Dimapur Police has enforced a vehicular restriction for 1 hour prior and 4 hours post-arrival of the special train along the designated route from Dimapur railway station to Agri Expo side, 4th Mart. However, in case of early or delay in arrival of the special train, the vehicular traffic restriction shall be enforced accordingly, 1 hour prior and 4 hours post-arrival. Another special train from Delhi with about 1,000 persons will be leaving Delhi on 14 June at 6 p.m. It will reach Dimapur on 16 June. Meanwhile, as per the control room empowered group Dimapur yesterday, a total of 149 stranded citizens have arrived in Nagaland, out of which 133 were from Delhi, Dibrugarh and Guwahati by train, while 16 have arrived from Morikaun, Akartala and Maharashtra by private cars. The state government today dismissed the news about a Manipur-bound truck driver who was found unconscious on National Highway near New Reserve Pesama this morning, circulated through social media as a COVID-19 positive patient as fake. Dismissing the report, Mission Director of Health and Family Welfare Department, Dr. Gevichusa Medikra, at a press briefing in Kohima said the driver had suffered stroke and showed sign of internal bleeding. Dr. Gevichusa Medikra also informed that a truck driver is still unconscious and being treated at a hospital. Secretary, Department of Empowerment of Persons with Disabilities, Shakuntala Kamlin, has stressed on the need to prioritize the effort to promote education, livelihood opportunities and social security of Divyang women. She said this while attending the online discussion for women with disabilities organized by the National Commission for Women. Shakuntala said that issues of girls and women with disabilities require sensitization of male and family members in the Indian paternalistic society. She said proactive and affirmative action should be the result-oriented to see that the rights of Divyang women with disabilities are realized fully in letter and spirit. And now 20 news, here are the main points again. Single highest spike of COVID-19 reported in the state with 26 new cases, increasing the total tally to 156. Nagaland government approves creation of 53 posts of specialist doctors in all 11 district hospitals. Nagaland government spends over 8 crore rupees for management of quarantine centres in all districts, and total lockdown imposed in Mon town beginning today till 15 June. That is all we have in this evening news bulletin. Good night.